Hello, I'm Michael Bond. I'm the current president of Maryland ACEP, and we just wanted to give a quick legislative public policy update to all of our members. With me today is Dr. Reginald Brown, who's our public policy chair and guru, helping us with lobbying and pushing agenda items through our state legislature. So, Dr. Brown, take it away and give us an update on what's happened this year.
Thank you, Mike. I certainly appreciate the time. And it's certainly in this time period important to present on legislative and public policy issues. As the Maryland chapter ACEP Public Policy and Legislative Chair, I just want to take a few minutes to update our members on both local and national politics and what we're doing as far as a policy committee. Times are changing, and it's imperative that our members are in the know. And if there was ever a burning platform or iceberg melting, it is now. There's barely room to stand on either, and we need to stand up for medicine, the profession of emergency medicine, and our patients. We are up against strong forces weakening healthcare access in our country, state, and our local communities. What have we done in the public policy team? So we are supporting access to care, a healthy environment to deliver care, and protecting emergency physician scope of practice and emergency physician fair compensation. In the last year, our committee participated in ACEP's Leadership and Advocacy Conference. We spoke with Senators Van Hollen and also Brooke staffers. We met with Representative Andy Harris in person and many other House staffers in Washington, D.C. It is well known that the state of Maryland is experiencing a huge deficit. Legislation for the next few years has to remain budget neutral. The current global budget is at risk and will likely be replaced by the ahead model. The details are yet to come. Much of our focus at the state is, in fact, budget neutral. We generally advocate for stronger penalties for assault of hospital employees. We are in favor of regulations like bike and motorbike helmets. I, in fact, personally testified in the last two sessions in favor of legislation opposing HMO's abuse of the NSA. Maryland emergency physicians have suffered greater than $5 million annually in lost revenues since the passage of the NSA. The result is decreased compensation to providers in what is already one of the lowest compensated regions. Politics are tricky sometimes, and an area of contention this year for our public policy committee was a proposed state mandated EMTALA legislation. ACEP strongly supports EMTALA nationally. However, there was concern that the new administration would roll back EMTALA and limiting access to patients. The state legislation was proposed by one of our physician colleagues, State Senator Dr. Lamb, who generally supports emergency medicine interests. Still, the legislation as written was concerning for double jeopardy, muddied waters for non-emergent reproductive care, and provided trial attorneys with another avenue to attack physician providers. We encouraged a robust conversation around this topic and ultimately provided feedback to Dr. Lamb. This provides a nice segue into federal legislation. Maryland ACEP requests your participation in federal policy. We regularly announce phone or email representative campaigns. The passage of the Big Beautiful Bill heightens the value of these efforts. However you feel about the current administration, the bill is not seen as favorable for EM providers. ACEP has released a statement or summary. The bill limits Medicaid to U.S. citizens, lawful permanent residents, and select alien classes. This will result in additional uncompensated care for undocumented workers. It also discourages undocumented residents from seeking care. The Big Beautiful Bill also limits student loans and student loan repayment. A maximum cap of $200,000 will price out many potential medical students and other professional students. It will likely contract the future physician workforce and reduce the overall pool of strong medical student candidates. I hope you heed this call to action. As I mentioned, there are many ways to support our advocacy interests. It is in your own personal interest and in the interest of our communities for you to get involved. We should endeavor to improve the field of emergency medicine for those behind us. Join us in our email campaigns. They make a difference. Support NEMPAC, ACEP, MedChi, and others. Please join us on our regular conversations in town halls and have your voice be heard. Thank you for your time this morning, and I look forward to more robust conversations around public policy in the interest of our patients and emergency physician providers.
Thank you so much, Reggie, for that update. On the last screen, just as we wrap this up, you'll see our QR code. Please use that to donate to our PAC so that we can have more influence in Maryland legislature and represent your interest. And if you have any topics or things that you think that we should be addressing, please reach out to Maryland ACEP. The following slide will have our email address. We're here to support you. So please let us know if there's any burning topics that you think that we are not addressing or should do a better job on. Thank you all.